My name is Evan Fonder. I serve as chair of the First Care Foundation, and that's really what brought me into involvement with the First Care Task Force. And why we're here today is really, we're looking at a transition back to local decision making and independent first care medical services, kind of like years past. Why we're here is really there's an agreement in place that's been in place since 2009 with Essentia Health that they would operate the hospital with basically some conditions that, hey, it's your hospital to run as long as you maintained these five care services, care delivery services. Certainly the one that's been in the media is labor and delivery. And that's just one of the components. And so the reality is that hasn't been lived up to. That service is not being offered. There's other pieces of that contract that you could get into that aren't being fulfilled as well, but really it comes back to holding someone accountable for their legal obligation, their contractual obligation, and so we're looking at legal proceedings that will lead to likely a situation where that agreement is ended, that contract is ended, and we'll be looking at, again, restoring first care medical services. And although this situation isn't ideal, I don't think any of us would choose to be here, certainly for the sake of the staff and out at our local clinic and hospital in Oakley and Bagley, certainly the community at large. But what this has done is it's kind of opened the door to a what could be, and maybe what services have been cut back, and in addition to the big one that we've all paid attention to here in the last 2 years. And it's really, I think, opened the door to it's opened the door to some really promising possibilities. When I sit down and talk with some of the past healthcare providers, some of the doctors that used to be delivering care here in Fosston, some of the current providers that are involved in healthcare here in the community, they have some really exciting ideas of what could be, of what care could be brought back, of what care that we don't have today that we could have. So it's really made me optimistic about where things are headed. It's kind of like the idea of once our local doctors and our local administrator can make some of those decisions on what care is appropriate, it really seems like we can go back to having a really high quality and kind of full service offering, even more so than we feel like we have today. A common question I get is, well, what about that specialty care? What about that outreach care that maybe you or a family member have received here, say cancer care, chemotherapy infusions, or cardiology visits or dermatology, some of those things. If we go back to being independent as First Care, where does that go? Because we'd be a smaller, independently run hospital. Well, through this process of kind of understanding the healthcare dynamic for small towns, I've had the fortune to talk to a number of hospitals across the state. And what I've learned and what our task force has learned is that there's a very common model where you have an independently run hospital, usually in a smaller town, that partners with a larger healthcare facility. And we are all aware of some of the larger ones around, CentraCare down towards the central Minnesota. You have Avera down in South Dakota. You have Sanford Health. You have Altru. Certainly, we all know of Essentia as well. But the reality is, you can be independently run and governed while basically having that partner to provide that specialty care. In addition, they can do things like help support your electronic medical record. We think of it as MyChart. They can support that system, which is really one of the most complicated parts of transitioning ownership or operations of a hospital. So they can support that electronic medical record, and then they can get basically what you'd call first right of refusal or first choice to be able to provide specialty care. So if locally, if it's back to First Care Medical Services, and the administration here and the doctors here determine, say, cardiology, that we could have a cardiologist visit 8 times a month or 8 days a month. If that partner provider, they would get the first choice to say, hey, yep, we can provide a cardiologist 8 days a month. If they can't, then as an independently run hospital, we have the ability to go out and find either an independent cardiologist or work with a different system style healthcare provider to fulfill that service. So today we don't have the ability to do that. Our providers and our administration here don't have the ability to do that. If we don't, we've seen it recently with dermatology care. We don't have Essentia doesn't have the capacity, so we just don't get it here. And we don't have the ability to go out and find someone else or find a different provider or find an independent provider. So when you think about it that way, we can still, as First Care, have chemotherapy infusion support here. In fact, there's ideas locally with the staff here that show a way we could actually expand that and have that multiple days a week with the right infrastructure and the right staffing put in place that they aren't able to do today, just due to some of the constraints within the system they're operating now. So it really comes back to, we can get cardiology care, we can get dermatology care, we can get oncology care, all the things that we fear that we would lose as a small hospital. Again, all these things come with a fee, so it's a partnership. So it's not just they come over and do it for free, but that's part of this next phase of researching where the hospital is headed, researching with the task force, talking with different hospitals across the state, talking with these other healthcare providers as we get closer to that transition to really kind of understand who would be that best partner. It really isn't a matter of if will be a partner or not. I think we've all learned on the task force that's the most likely and most stable way to keep a thriving hospital and clinic in place. So it's a matter of just who that partner will be and what that partnership will entail and all of the back-end services they might help with, etc. But it really comes back to where are we headed as the hospital and clinic system for our region. And it really is looking like we're headed towards an independently run First Care Medical Services. Kind of prior to 2009, that's what we had, but I think it can even be stronger and better than what it was then. I think there was a day when many of us, and certainly generations above me, have a tremendous amount of pride in what healthcare in Fosston and for the surrounding area looked like. And that has been a challenging thing to see degrade and services degrade here over the last few years. And so I'm really excited about where it's headed and bringing that pride back to what small town healthcare can be, because we have an amazing staff out here. We have really knowledgeable doctors, nurse practitioners, PAs, nurses, etc. that can deliver very high quality care and do deliver high quality care. And if they are empowered to basically impact and bring up and make decisions about other care or ways to deliver care here that they can't today, boy, I think it's really going to lead to something special for our community as it relates to healthcare. And you go back to the idea of Fosston and this area being vibrant because of healthcare. When you look at all of the different healthcare offerings, be it in the dental world, the eye clinic world, chiropractic care, pharmacy, nursing home, or assisted living, there's a lot to offer here. And I think that's a big part of why this area has remained vibrant. That's certainly a workforce. It brings people that as they age and need access to that care. So it is important that we have a vibrant hospital and clinic and full service offering. Certainly understanding that there's going to be complex care that will always be referred out. But the more we can do here and the more we can have an empowered staff that can make decisions and kind of have those conversations about what care could look like here in Fosston, I think that's a really positive thing, and I'm really excited for where that is headed.